Hey everyone, how are you? My name's RJ, and I'm here to help you guys educate yourselves, to help you guys learn how poor the testing is for Lyme disease and co-infections, to learn about how many people actually have Lyme disease when really they don't know it. They've been misdiagnosed, they've been told they have chronic fatigue syndrome, they've been told they have irritable bowel syndrome, they've been tested negatively, 5, 6, 7 times. They either think they have Lyme disease or they don't think they have Lyme disease, but they actually do. I'm here to help give some direction. Uh, I'm here out of anger, half of it, for what the situation is that's going on with Lyme disease. And I'm here to try and make a difference for you guys and just save you guys the struggle and the time and money it took for me and my family and I uh, to come up with this diagnosis and this treatment. Um, I'm going to sort of give you guys just a little background of myself and how this came upon with me. First of all, I was actually a very high level tennis player. At one point, I almost was going to turn professional. I was a very highly nationally ranked player, as well as a pretty decently internationally ranked player, and was fortunate enough to play the game of tennis and enjoy it for a lot of my life. That was up until I was a junior in college, and I had noticed throughout my life I knew I had OCD. I knew I had issues with cramping, issues with aches and pains, but I didn't really, I was an athlete, and you have to understand the mentality of an athlete, as I'm sure many of you know, is you're a fighter, and you don't let little things, stop you, little aches and little pains, which probably weren't so little, but you just learn to tough it out. So in any case, the day that this all changed for me was the day of my 21st birthday, of which I almost fainted. I was at Penn Station. I was walking around, and literally all of a sudden I started to get these feelings like I was going to pass out. Somehow knew to put my head down. For anyone that struggles with orthostatic hypotension or some sort of orthostatic hypotensive issue, something that causes low blood pressure, you would know that that's actually a very smart thing to do to get your head down. Well, I didn't actually know, but I was lucky that my instincts just sort of had me go down. And I protected myself from fainting. I had a very cold sweat. I got very pale, but didn't pass out. But this moment changed my life forever, and still to this day. That was 2 years ago. It will be 2 years ago in 2 months. So that was almost 2 years ago. And basically, I'll summarize this time. There are portions of my disease and this problem, but I'll sort of break it down for you guys pretty simply as best as I can. This is a very scattered issue, and you really need to try as best as you can to really pay attention to each of the categories of treatment and disease. And I'm going to have a little channel here with multiple sort of things for you guys in multiple videos. So anyway, so to summarize it, the next 8 months before I got a diagnosis were basically doctor after doctor, test after test, Lyme disease test after Lyme disease test. We sort of suspected it, not because of any rash or any bullseye, which is only shown 1 out of 10 cases. It's almost never seen, and you have to be lucky to catch it within the hour of which you've been bitten. Never saw anything like that. Just sort of my symptoms matched a little bit, but it also matched with mono, chromosomal disorders. I mean, forget it. I mean, you look up the definition of cancer, and and you see the symptoms, and you'll drive yourself crazy. So, had been in 2 emergency rooms, had been admitted to one, and I was having symptoms. There were about 40 different symptoms, but symptoms like basically heart issues with skips. I had headaches, fevers, chills, aches and pains, neck pain, foot pain for some reason, although it's not that common. A lot of neck and back pain are common. I had vertigo. I had, of course, orthostatic hypotension. I would go from, my blood pressure would drop. I would feel like I was going to faint. My heart rate would be up in the 150s, 160 when I would wake up in the morning standing up. I mean, just outrageous. Trying to think what else. There were just so many. I had double vision, blurry vision. Just the worst. Cloudy brain fog, cloudy thinking. Couldn't remember so many things, and of course a worsening in OCD, which I really stress for people. Even with psychiatric disorder, for a long time, it's very important to look into Lyme disease because a lot of people don't really know what these psychiatric disorders come from. So, getting back to that, so I'd been tested for Lyme disease through this 8-month period for about, say, probably 5 or 6 times. At this point, I'm in a wheelchair. I can't walk. I can't go to the bathroom by myself, which is very embarrassing. I need help just to go to the bathroom. I can't shower standing up. I showered sitting on the floor for weeks. It was I didn't actually, at one point, I didn't go out of my house for 5 weeks straight. Now, of course, there are people that have been a lot sicker than myself. I'm not complaining, but this was a serious situation. And it's not until that my father makes the diagnosis of something called postural orthostatic tachycardia syndrome, also known as POTS, P-O-T-S. Can also be sort of known as orthostatic hypotension, although there's a little difference in symptoms of those two, but they're really linked. One is specifically just with the heart, the other one is only blood pressure, but you can also have a dropping in blood pressure in POTS. So there's a real similarity into those. And it's when my father, who's by the way a physician, he's retired, but he specialized in geriatrics and was an internist, and wasn't until he made the diagnosis of me just by simply putting a blood pressure cuff on me and checking my blood pressure going from the sitting to standing position, where he would see that my blood pressure would go from 120/80 sitting to I would literally stand up and I would literally almost pass out immediately, and I would drop to 70/60 in 10 seconds. So major, what we later know as autonomic nervous system issues, major issues. Also, my heart rate would jump immediately 30-40 beats, and I would, already naturally be sitting kind of fast. Not enough that really I was complaining about it. Also, being an athlete, you tend to used to your heart racing. But so it wasn't until we made this diagnosis of POTS that we finally started to realize, well, okay, this is a syndrome. What is this syndrome coming from? I never had this my whole life, right? And I think, on a side note of this, too many people accept bad health. Too many people, for what it took for me to really realize that there was an issue, the whole roof caved in. Now, granted, sometimes it takes that to do the drastic measures to find a diagnosis for Lyme disease. But just in general, keep that in the back of your minds. Pay attention to your bodies. So anyway, finally figured out that, my father, not me, my father figured out that the testing for Lyme disease was horrible. That the chances of you getting tested positively were roughly at about 2%. And this was for a very specific reason, because the bacteria are of many species and they are capable of presenting different proteins on their outer shell. That means that basically they can change their outer electron and change their protein and allow them to completely look like almost like a different organism. Not a pre-med student or anything, so just doing this off of memory and off of, luckily I'm working with probably the best doctors in the world for this, as well as my father. And the other part that was very interesting to my father was the fact that there were so many co-infections, which most people don't even test for in the United States. The CDC barely recognizes them. CDC is the Center for Disease Control. They barely recognize them. Most doctors don't even know what this is. So, my father reads all about this. My father reads that there's one specific lab that tests properly. And these doctors that will send the kits that they'll request for a kit and they'll send it to these labs are known as ILADS doctors, International Lyme Disease Association doctors. Forgive me, that's not perfect, but it's ILADS, I-L-A-D-S. And these are the doctors that treat Lyme disease. So sure enough, we end up getting an IGNX test, and this is through the one and only Dr. Richard Horowitz and John Fallon. John Fallon is his nurse practitioner. Two incredible men that are doing God's work. They are, I owe my life to them. And these are people, Dr. Horowitz, you may know him from the book, Why Can't I Get Better? There's also a new book coming out from him that is, How Can I Get Better? The second one, How Can I Get Better, is coming out in November. You really should try and get your hands on it for anyone that is possibly has had Lyme disease, thinks they have Lyme disease, or knows someone who does. Really important. And they really opened up my eyes as to, well, first off, I tested positive for Lyme disease, the Burgdorferi bacteria, as well as Babesia and Bartonella, as well as tularemia. But that was, there was a question as to whether that's just an inflammation reaction, whether that's really not a actual diagnosis of tularemia. But there was certain Babesia and a very high Bartonella titer. For all of you that don't know what these are the co-infections of Lyme disease that, once again, a lot of doctors don't even know what they are, and they can be transferred from the same tick bite that when you're bitten. So you can get sometimes 2-3 co-infections. Other co-infections, I mentioned Babesia, Bartonella, tularemia, Ehrlichia, Rocky Spotted Mountain Fever, Mycoplasma, Anaplasma. These are just a few of them that you can get from one tick bite. So as you can imagine, I test positive for these things, and for the 3 that I mentioned. And this is when I start to learn about all this stuff, and we start to learn that, well, number one, they say, turn to me and they say, John Fallon says, RJ, these bacteria, they replicate very slowly. Some of them replicate even as slowly as every 28 days. The Lyme bacteria can replicate every 28 days. Bartonella is another very slow replicating bacteria. Babesia is a parasite, and a very difficult parasite to get into. And these bacteria can hide in something called biofilms. Okay, they can hide in the cyst form. And because of all these reasons, just because of the fact that the bacteria replicate every 28 days, means that you have to be on an antibiotic regimen for a very long time. A very long time. We're talking, think of it like this. When you have strep throat and your doctor prescribes for you the antibiotics appropriate for strep throat, strep bacteria can replicate roughly every 4 to 6 hours. So when you're prescribed a 14-day antibiotic course, that's very adequate. You're getting through multiple replication cycles and killing die-offs. That's when you kill bacteria every 4 to 6 hours of these bacteria. So Lyme disease, however, replicates very slowly. So to try and say that you can treat these in 2 weeks or a month, whatever the CDC bullshit says, excuse my language, but I'm very upset, is preposterous. And it's just completely not accurate. You would only get through one replication cycle. You would barely start the killing. The only way this could possibly work, and I say possibly, is if you've just been bitten, and if you're lucky enough, since CDC doesn't even really pay attention to Bartonella, Babesia, tularemia, Ehrlichia, all these co-infections, the only way you could possibly be lucky enough is if you didn't get any of the other infections, just you saw the bullseye, you saw the tick, and well, you don't need to see the tick, but you saw the bullseye, and you treated for 2 weeks or a month, and you were lucky enough that it didn't replicate quickly enough, and therefore you've beaten it. That being said, if you have not done this, and you've either only treated for 2 weeks and it didn't treat properly, or you can imagine what can go wrong if you're not one of these people who isn't lucky enough like that, hence myself. And the bacteria replicate, and they replicate, and they replicate, and it's not until you get very sick that you then have to start treatment. But of course, once again, because these bacteria replicate so slowly, you have to be on a very long antibiotic course, consisting of sometimes, I'm on, I believe, 4 antibiotics, 1 IV. I'm on 2 antiparasitics. I'm on 1 I'll go into everything I'm on, but I'm also on 1 antiviral. So the next thing they bring light to me is about how you must also get a very significant, very adequate and diverse virus testing. You have to get tested for viruses, toxic metal, mold, Candida, yeast. The reason you have to do all this is because when your immune system is so compromised, there can be things that are called opportunistic infections. Infections that happen when your immune system is basically on its back. Think of it as all your soldiers are being used for one infection, therefore others can invade. That's as simply as I can provide it for anyone who's non-medical out there like myself. And so these, so I happen to test for a very high titer of herpes virus 6, not the herpes that you get from sexually transmitted things. Herpes, it's just a herpes. There's many herpes viruses, and herpes virus 6 is one that is not so uncommon, and I happen to test a very high titer. Now, of course, if you're not treating this simultaneously, you are not getting better. And that's a real problem because, of course, most people don't even get, number one, they're lucky to even get some sort of diagnosis with, a virus. So let alone do they get these Lyme disease tests, which test hardly, ever positive, and the whole thing becomes a huge health complication. So I tested positive for herpes virus 6. I also tested positive for mercury poisoning, lead poisoning. Now people are saying, what are you, lead poisoning, you eating walls? No, I'm not eating walls, and I'm not eating thermometers with mercury in them. No, I'm not. I was simply, what happens to Lyme disease is many of your it attacks many of your bodily functions. You should read Dr. Horowitz's book and the 16 different parts to treating Lyme disease successfully. And that is no joke, 100% no joke. I am fully a product of treating 16 different things correctly. Of course, I'm knocking on wood with that, but I ended up, and the reason for this is your body stops being able to produce the natural function of getting rid of these toxic metals, and therefore these toxic metals store. These toxic metals, mercury poisoning alone can cause nerve problems, nerve issues, and I also had a little bit of mold testing, a little bit of mold, which I had a little high testing of, and so of course we're left with this whole this scattered thing, and of course this is all to me this is blowing my mind. I'm thinking here, to me, look, I knew I was sick, but I couldn't believe all these things that I had, and how many people there were in Dr. Horowitz's practice, and John Fallon's practice, and Dr. Bernard Raxlin's practice, and Dr. Ligner's practice, and Dr. Younger's practice, and Dr. Charles Ray Jones' practice. How many people had the same exact things? And how many people time and time again, the same symptoms, the same, and all this stuff. I'll also mention that I had, they ended up, Dr. Horowitz requested that I would do, John Fallon requested that I would do a cortisol test, which I actually did in a spit test by Doctor's Data. Sidebar, Doctor's Data is an extremely reliable lab, and I recommend it for the toxic metals and for your regular metals and for magnesium, stuff like this. They really do a good job. They do a very good detoxification test. They do just phenomenal work, and it's really hard to get good testing is what I've learned through this. And so my cortisol tests they're 1/6 of the normal levels, which of course that alone can cause orthostatic hypotension, cause POTS, just because the fact is that you're not getting enough cortisol. Your adrenals aren't functioning properly. I had extreme adrenal fatigue, and immediately when I got on cortisol, I got a lot better. I'm now going to fast forward to today. So that was the initial findings of everything, and then through today, and through all this has been aggressive treatment of antibiotic treatment. I do not believe that you can beat this alone on herbals. Herbals are tremendous. Things like serrapeptase, lumbar kinase, nanokinase. The list goes on and on. Those are just for biofilms, but there are millions of things you can do herbally and diet-wise, and they do help. But I do really, really have to say that the antibiotics are really necessary, as well as the most important part of this stuff, which is your overall regimen of antibiotics, herbals. Okay, I was on 4 or 5 antibiotics, herbals. I was on an antiviral. I'm still on all these things. What am I saying was? I'm still on all these things. I was on 5 or 6 different herbals. I was on at one point sort of, medicine for POTS that eventually has gone away. I'm also on something called IVIG, intravenous immunoglobulin, at a dose. Intravenous immunoglobulin is basically your body, when your body starts to have an autoimmune problem, when you get so sick like I did, your body can actually develop an autoimmune problem. This was confirmed with the nerve conduction studies that tested that I had demyelinating nerves and a peripheral neuropathy. So the IVIG has really helped that. I do it at a dose of 75 grams over 2 consecutive days, totaling 150 grams. And that has helped significantly. And fast forwarding to today, IV antibiotics, 3 or 4 antibiotics, 2 antiparasitics, 1 antiviral. I have really gotten through being sick, and I'm on the other end of it. I will take a sidebar here and really focus a little bit on the testing. So I told you guys about the testing and how the testing is not good. Now I'm going to tell you guys how this is good. And I'm here for you guys. I'm not just here to describe my story. I'm here to help. IGeneX. That's one word answer, and that's what you guys need to know. IGeneX. This is the only lab that you can test that is really good. There are a few others that say, hey, they sort of do okay. IGeneX. You need IGeneX. IGeneX is the lab that does the best testing. You need to get the complete Lyme panel if you can afford it, and the I believe it's the Western Region Co-Infection panel. The reason for this is because, of course, like anything, the less money you spend on it, the less quality you're going to get. I think it sums up to about $1,200. I don't think insurance covers much of it, and it is the only real testing that will test positive. And of course, some people, are so sick, right, and they've spent so much money that at $1,200 at the end of it, is like nothing compared to all the doctors they've seen. So I'm basically, a victim of that, and we basically spent thousands of dollars. Luckily, we had sort of the money, and we were able to do it. But there are a lot of people that can't afford that, okay? And there are a lot of people that, and really we couldn't afford, but, we found a way. But I'm trying to save you guys, and I'm trying to make this steps shorter. I'm trying to say, if you know someone with Lyme disease, if you know someone that could possibly have it, if you know someone that has these, they're finding 30% of autism has Lyme, is Lyme disease. 30%, they're finding that a huge percent of MS is not MS, it's Lyme disease. Chronic fatigue syndrome, I'm going to go into a video about that. That is not a diagnosis. That is not a diagnosis at all, okay? Chronic fatigue syndrome is when they don't know what it is, okay? And they basically have to give you something, okay, to explain why you're sick. Irritable bowel syndrome. This is another one. Okay, this is another one. Really, Lyme disease loves to go to the brain, the nerves, and the stomach. Okay, a lot of people, you'll also know, they get achy, swollen glands, like myself. I was an extreme case, but there are plenty like me, trust me, but there are also plenty that are not. There are plenty that have just, their sort of quality of life is like at 80%. They don't really know why. They maybe were bitten once before, or they've never been bitten, but they live in Long Island, New York, and they're camping all the time. This is not their fault, but this is not a terribly hard thing to figure out once you learn about these things. I recommend you guys to really go into iLads and to really go, to learn about iLads, to learn about Lyme disease testing, and to avoid the CDC. The CDC says that you have to test positive for 5 bands. You basically have to be dead, or you basically have to be just bitten to test positive for 5 bands. I tested positive for 2 bands. Okay, 2 bands, not 5, 2. And people will say, well, oh, sorry, this went black, guys. People will say, oh, well, that's not right. And I'm going to have a video really recapping some of this stuff. This is my general story. But 2 bands I tested. I tested a very high titer for Bartonella. I tested a reasonably high titer for Babesia, but I tested not so high for Lyme disease, only 2 out of 5. However, it's also, on a side note, very important to know which bands you're testing positive for. I think it was 41, the one that I tested positive for. You can also learn about that. Bands are very important. Bottom line is, I don't believe you should have any bands. You know, I don't have any bands of anything else. Why should I have bands for this? And I'm happy to say that I'm on the other side of this. And I'm doing very well. I'm now getting back on the tennis court. I'm still on IV antibiotics. It's been a full year of treatment, actually about a year and 2-3 months. I'm planning to go for another year, and then I'll probably stick to herbals, assuming that it has been a successful treatment. There are a lot of times treatment failures, as you can learn in Lyme disease. I also really recommend, if any of you have children, to look into Dr. Charles Ray Jones. He is one of the godfathers of Lyme disease, up there with Dr. Horowitz. He is also really good with pandas and pans. He is a true gentleman and a spectacular man. He is so well informed, and he has battled these people. You know, you'll find a lot of these doctors have been indicted for maltreatment, malpractice, whatever you want to. You know, the insurance companies sue them. They're trying to get their medical license taken away. What I'll tell you in Lyme disease, and what I'm learning even in other diseases, learning stuff like in autism, if your doctor hasn't been indicted, you're not with the right doctor. And this is the most corrupt thing I can think of. You know, just alone, when you start to learn about how the insurance companies have possibly paid for these studies to be done and all this stuff, because of course, Lyme disease is such a slow replicating bacteria that if someone has been chronically ill with Lyme disease, meaning greater than 6 months, you'll have people that have to be on antibiotics for 2-3 years. But of course, what happens? What happens when an insurance company has to, pay for someone for 2 years on IV antibiotics? They can't afford this. This would wipe them out. They also say that 30,000 people were ill with Lyme disease, when they really, CDC finally turned it around and said, no, it's about 300,000. I actually don't know if they officially turned around. I think they did, but it was around 300,000. CDC is completely off with all their numbers. Anyway, I really recommend you guys to look into this. I'm going to make definitely a bunch of other videos, and I only do this to try and help you guys. This is not a someone who's doing this for attention. I really don't care much for the attention. I'm literally doing this to try and help. I really will answer questions, and I'm going to write my email down. It's very hard to get any sort of answer and very clear picture. But I do also recommend, for anyone that knows anyone with some sort of chronic illness that has never gotten a diagnosis, a straightforward diagnosis. Even someone says, oh, I have autoimmune disorder, autoimmune disease. Don't forget, don't keep this out of your mind. I have autoimmune problem from the disease. Okay, from the disease, from the overwhelming infection. Your body's getting invaded years after years. These bacteria are replicating, and sure enough, you get very sick, and you develop an autoimmune problem. So anyone that's really had any sort of autoimmune problem, any long-lasting thing that they've not gotten an answer for, really worth spending, the money that I'm sure you guys have already spent a ton of, and to get an answer. So all right, this is goodbye for now, and I look forward to giving you guys plenty more videos, and of course, send me any questions. Bye.